So welcome to the Maternal Hypertension Center.
You.
Why did your physician send you?
I had the first pregnancy that ended at 34 weeks with preeclampsia.
And were you in the bed before?
Yes,
for
I
any
was on
prolonged
bed rest.
Bed rest?
Bed rest.
Okay. How long had your blood pressure been up before you delivered?
About 3 weeks.
About 3 weeks? You delivered by normal route or cesarean section?
Cesarean, after 30 hours of labor.
Oh my goodness. Oh my goodness. Did you have to have that magnesium sulfate?
Yes.
How was that?
It was bad.
It was bad?
I was sick for a few days.
Okay. And your baby was how big?
6'1".
And did it go to the normal nursery or to the
No,
intensive
he
care?
went to the intensive care.
Intensive care.
Yes.
And did it have breathing problems?
Yes.
And how long did that last?
About 4 days.
Okay.
Yeah.
Okay. How'd you feel about that?
It was horrible.
So you're willing to do what's necessary to
Yes.
prevent that from
I
happening
do not
again?
want a baby to go to the NICU unit.
Again.
I want to take him home with me.
Okay. This is often hereditary in this part of Appalachia. Family members have blood pressure problems? Who?
Yes, my mother.
Just your mother?
And my sister.
And your sister? Okay. So there is a variation. We'd like to put you in the group that's not going to have problems.
I don't want to get sick again.
Okay.
My first pregnancy started with no complications, but I did have a history of high blood pressure for myself. I was not aware of my family history and how at risk I was to get sick with the preeclampsia. I had my contractions stopped twice. It was a very troubled pregnancy. I was on bed rest. It was a huge financial burden for my husband. My family had to do the laundry, get the nursery ready, do all of the daily activities that I couldn't do. And my first son was delivered at 34 weeks after getting extremely ill. My blood pressure shot up. I was having twitches in my face, and the doctor, unfortunately, has to deliver in order to cure the illness.
We've just run a very special test that measures how much blood your heart is pumping, how hard your heart's working, as well as what the blood pressure is. Those two things are what go into assigning risk for later on in pregnancy. Okay? For any given blood pressure, you can have people that have too much blood flow. Think of a fire hose shooting a whole bunch of water out. Or you can have people that have too low of blood flow. Think of a garden hose with a little nozzle. Now they can both generate a stream that'll reach the same distance. One has a huge amount of flow, one doesn't have enough. And then there's a mixed group where there's a component of both of them. A little bit of too much, as well as the blood vessels being a little bit too tight. And what we found here in the Hypertension Center is that by targeting which kind you have, giving you the medication that treats which one you have, we can reduce the incidence of blood pressure problems in pregnancy. No guarantees. Okay? What we found is that we cut the incidence of toxemia, which is what caused your premature delivery, in half. The average and the median, statistical term, gestational age at delivery is 37 weeks. Okay? Growth restriction is not increased. In fact, it's the same as the general population in people whom I would expect would have an even higher chance of having small babies. Okay, so the goal here is to target exactly what your body needs rather than doing what I used to do, which is just give you my favorite blood pressure medicine and hope it works. And that's kind of what everybody else does in this country as well. Okay, your primary problem seems to be at this point too tight of blood vessels, and we want those to relax. And so we're going to give you this once-a-day medication. Now, we don't cut you loose. We follow because pregnancy changes things over time. Right? So we're going to see you every month. As your body changes in pregnancy, if the hemodynamics change, we'll change the medication or add other medications. Because growth of the baby is very, very important, you get an ultrasound every month to make sure the baby's growing. Okay?
Okay.
We're not perfect. So at 7 months, we start twice-a-week testing. We test the baby's health using a variety of methods twice a week from then until you deliver. Okay?
Okay.
So we're now 6 weeks after delivery. How far did you get this time?
38 weeks before I got sick and 39 to delivery.
Oh my goodness. How far along were you when you delivered?
39 weeks.
Okay. How big was the baby?
7'3".
All right. A C-section again,
Yes.
I understand.
Yes.
Did you require the magnesium sulfate
No.
this time? The baby went home with you.
Yes.
You liked this experience better than
Oh, it was
the
much
first
better.
time around?
Much better.
In spite of the inconvenience of having to come to the hypertension center, was that a problem?
No.
Okay.
No, it was worth it.
Okay.
The maternal hypertension center had the equipment that was needed to monitor my symptoms and monitor my progress through the pregnancy. And their knowledge and their staying on top of our pregnancy and on top of the situation with the baby let him come home with us. And it was just a much different experience. They helped me have a healthy baby. They helped me have one to take home.